Go ahead, please.
Gracias. Good morning and congratulations on this program. I think it's very good. I'm Professor Maria de Los Angeles Fernandez, and the question is the following. Is there any bibliography, any specific bibliography that you could recommend us teachers who are teaching organizational development for higher education and secondary education so that we can help the students cope with stress and stress management in general?
Gentlemen,
Señores,
any particular bibliographical citation or books that you would recommend on stress and stress in the organization? Obviously, Hans Seeley's old 1950s book, The Stress of Life, is a classic.
Yes, is a good place to start. There are a number of publications. I should have brought a more formal bibliography. There is a British publication. I'm trying to remember the editor. I'm not doing well with this. I'm sorry. Called Stress and Work, which is an excellent collection of papers and articles, and I would strongly recommend that book.
Can they fax us or write us here to get more specific bibliography?
Yes, by all means.
Okay.
By all means.
Krishna.
I did mention this earlier, but there is a very interesting and extremely small, about only 36 pages, and each page refers to one reason why people are stressed in the workplace, particularly when there is an organizational change, and what do you do to overcome that. And these are some of the tips that are extremely useful, and it is fairly up to date.
And how do they get a hold of this?
It is there in the document that I have presented earlier.
Very good. So that's already available to you. But don't hesitate to fax the station here, and we can provide you with some more complete bibliographical citations. Our next call is from Manta, Ecuador, from M.A.R.E. y Compañía Consultores. Go ahead, please, from Ecuador.
our question is the following. In the company, within the organization, how can we help our employees to reduce or avoid stress?
Okay, the question is related to what in the organization, what can managers or the company itself do to help employees avoid stress? What are some of the really proactive, innovative things we're doing?
Good question. That really is. I'll just start off with something. This is really your area of expertise, much more than mine. First of all, I don't think you can avoid the stress. What you can do is mitigate it. And you can do things like providing positive feedback when employees are doing well. There's remarkably little of that in industrial settings. You can set up social structures among workers so that they support each other. Some of the recent team approaches, I think, are useful in that regard. Things like that, where you actually change the social organization of the work environment, are very good ways to mitigate stress.
And Krishna, something to add to that?
Yes. The International Labor Organization, with which I was associated for over a decade, has been very particular about safety and health in workplace, which takes into account the code of conduct for environmental requirements, the safety requirements, safety training, and a variety of items that go to have a more healthy lifestyle in the workplace itself.
And more companies are being more attentive to these issues these days, do you believe?
I believe so, too.
Okay. Good. All right. I believe our final question in this segment comes to us from Santo Domingo in República Dominicana, and it's from a caller at Codetel. Go ahead from the Dominican Republic, please.
Question is as follows. Good morning. The employees who offer customer support are usually the ones that are more stressed, and that stress does influence and affect the service that they're offering. So what can we do to relieve the level of stress or help them cope with that stress, and what suggestions do you have to solving this problem?
Okay, employees that have contact with customers are often under significant stress, and yet they have to please the customers. What can we do to alleviate their stress?
Yes, it is a very puzzling question. It is one of the hazards of a service organization. You are representing the company as the front person when you're dealing with a customer, and if the customer is not satisfied with your answers, the customer is not satisfied with the whole company. And therefore, there are many ways in which these employees have to be trained to know exactly what to say, how to deal with the customers. It is a question of training them in the right direction.
All right. Very good. Well, thank you for your questions. Now let's move to the second module of our program. One chronic disease that has been increasing dramatically is bronchial asthma. The rate of asthma in many countries is soaring, particularly among senior citizens and children. Many causes have been suggested for this increase, including environmental pollution, stress, urbanization, and even the presence of insects such as dust mites and cockroaches. One theory suggests that our better overall health and the fact that there are fewer parasites in our environment cause our immune system to attack itself. The result, autoimmune diseases like asthma. I am especially interested in this segment of our program since I myself have had asthma for more than 50 years. We have another panel of distinguished experts to discuss this important topic. Dr. Stephen Wasserman, who could not make it to this portion of the program, is former chair and professor at the Department of Medicine at the University of California, San Diego. Dr. Wasserman has 23 years of clinical research experience in asthma, rhinitis, and other allergic disorders. His areas of specialization include allergy testing, such as skin testing, pulmonary testing, including allergen and provocative challenges, and bronchial lavage and biopsy. Dr. Wasserman was chair of the American Academy of Allergy, Asthma, and Immunology. He has served as principal investigator in 8 clinical studies and has been a participating investigator in 60 clinical studies. Our second guest is Dr. Anthony Horner, professor in the Department of Medicine at the University of California, San Diego. His experience is in asthma, allergic rhinitis, cystic fibrosis, immunodeficiency disorders, and sinopulmonary infections. He practices mainly pediatric medicine, having carried out much research in the area of asthma in high-risk children. He has been principal investigator on 5 clinical studies and participating investigators on 3 clinical studies. Our third panelist is Dr. Geeta Venkat, who specializes in diagnosis and treatment of allergic diseases in adults, adolescents, and children. She is board certified by the American Board of Allergy and Immunology and the American Board of Pediatrics. She is also a fellow of the American Academy of Allergy and Immunology and American College of Allergists and the American Academy of Pediatrics. Dr. Venkat has practiced in Mission Viejo, California since 1985 and is a member of the Mission Community Saddleback Memorial South Coast, San Clemente, and Irvine Medical Center, as well as assistant professor at the University of California, Irvine. Our fourth speaker is Venu Prabaker, a practicing physician who specializes in internal medicine and primary care. Dr. Prabaker is an assistant professor at Western University, California, and former assistant professor of internal medicine at Stanford University. Previously, he was chairman of internal medicine for Sharp Grossmont Residency Program. Welcome all. I'd like to start with a question. Despite dozens of new treatments for allergy and asthma, why is asthma increasing epidemically? And does this trend hold true all over the world?
Well, I think I'll answer that question
Sure.
if it's okay. I think the trends, are disturbing, as I'm sure everyone agrees. Second of all, one of the things that's underappreciated is the medications that we have available, although very effective for treating symptoms and making people feel better, are not really cures for the disease. And so we're still waiting for a magic bullet in terms of actually some sort of intervention that could either effectively prevent the development of asthma or could effectively cure it so that people would not be dependent on medications to keep them well.
Panelists, anything to add to that?
I think the incidence of asthma is increasing also probably because of pollution and perhaps excessive keeping of pets at home, particularly cats. Almost every household has pets nowadays compared to many years ago, and that causes allergies and causes the aggravation of asthma.
And this increase in allergies and asthma, true all over the world, Latin America, Europe, Asia?
Yes, in fact, the prevalence of allergies and asthma has increased over the years. The incidence of asthma is about 17 million Americans suffer from asthma in the United States alone. But also there is increased asthma in incidence of asthma all over the world, especially the English-speaking countries.
I probably should have said something else when I spoke a second ago in terms of the prevalence issue. It's true, especially in developed countries and English-speaking countries, that the prevalence and incidence of asthma and other allergic diseases has increased dramatically over the last 5 or so decades. And one of the theories that's been proposed is that modern health practices in terms of sterilizing our environment and reducing our risk of all sorts of infectious diseases, which certainly also cause a lot of morbidity and suffering, has led to an immune system that doesn't have enough to do, if you will. And the consequence of that is that in these countries where we see lower incidences of infectious diseases, we are seeing these trends. And interestingly enough, in a lot of third world countries, especially in rural environments, we're not seeing these same epidemiologic trends in terms of increases in asthma.
So more exposure to bacteria and viruses in rural areas, more for the immune system to do, and less asthma and allergy as a result?
It's like keeping children busy so they don't get into trouble.
So the old adage, pound of dirt before you're two, in terms of a kid eating dirt, may not be the worst advice.
Exactly right. Exactly right.
In addition to that, many of the developing countries are getting industrialized, and because of that, a lot of automobiles and a lot of fumes, industrial combustions, as mentioned earlier, carbon monoxide, nitrogen dioxide, sulfur dioxide, all of them are released into the environment. Many of these countries, they don't have stringent restrictions and laws regarding these pollutants.
Sure.
So all these things are released into the urban area. So much so, the incidence of anthraquinal asthma is escalating.
And certainly smoking and secondhand smoke is a factor, eh?
Absolutely.
Okay.
As Dr. Prabaker mentioned, the rural areas are not affected as much because there is less of pollution and there is a greater environmental control there. And we are thankful for that. We hope that that will continue.
All right. In terms of organizational change, what can you hear about sick buildings and other environmental stressors? What can companies do?
One of the major efforts they can do is to implement preventive aspects. For example, dampness and increased humidity can cause increased incidence of bronchial asthma, and it happens due to mold, increasing in mold, and it's a beautiful habitat for cockroaches. So all those things can be prevented by reducing the humidity.
Yeah.
And some of the meters are available to estimate the humidity inside the environment, and that can be implemented, and we need to maintain a humidity level of 50 or 60%.
Well, we'll come back and talk more about some of those issues because they're very interesting issues. Now let's move to our next tape module, an interview with our panelists. I think you'll find it quite insightful, and then we'll have our panelists back a little later on. Thank you.
Welcome to the second half of the topic on health and productivity. We have here today a very distinguished panel of experts on asthma who are going to tell us all about how it affects health and productivity. We have here Dr. Venkat, Dr. Horner, Dr. Wasserman, and Dr. Prabaker. Dr. Venkat, what is asthma?
Asthma is a chronic inflammatory disease that affects about 17 million Americans. It is a lung disease that is characterized by bronchoconstriction, as well as which manifests itself as a cough or wheezing, and it has a lot of effect on school absenteeism. It's the number one, in fact, it's the number one cause of school absenteeism in children and work loss days in adults. It is characterized by two main components. One is the bronchoconstrictive component, and the other is an inflammatory component. The inflammation basically in the bronchial tubes, there is mucus production, as well as there is smooth muscle spasm, and there is infiltration of the mucous membranes by various inflammatory cells that causes the various symptoms of asthma.
Okay. Why is asthma an important disease, Dr. Prabaker?
Actually, the incidence of bronchial asthma is staggering. 17 million people are affected, and something like 5 to 7% of adults are affected by this disease. Recently heard that in California alone, 12% of the population are affected by this. And in children, it is much more prevalent. It's about 6 to 10% of the people, of the children, are affected. 1 in 13 child, is affected by bronchial asthma. And as Dr. Venkat mentioned, it's one of the leading causes of absenteeism from school. It is extremely important to know that. And one of the fascinating incidents you see is 33% of all the ER visits for children are due to bronchial asthma, and up to 25% of patient visits, children, as well as children is concerned in a pediatric office, is due to bronchial asthma.
What are the current developments surrounding the link between genetics and asthma?
Like all diseases, genetics play an important role in the susceptibility of the individual and the severity of the disease. Asthma is very complex. As was mentioned earlier, there's an inflammatory component, there is a component of airway obstruction and bronchial constriction, and each of these has their own genetic regulation. In allergic individuals, the ability to become allergic and what one becomes allergic to are also under genetic regulation. When individuals have studied populations with asthma and have asked the question, can I find a gene or several genes that might help explain why this group of people has asthma and this group does not, a number of candidate genes have been identified. Some of these are merely locations on a chromosome, and others seem to be important genes regulating different parts of the immune reaction. Some regulate how irritable the airway can become, some regulate the ability to become allergic, and others seem to regulate pathways in the body that are defense pathways. And if these defense pathways are not sufficiently active, then that too can predispose to asthma.
Yeah, we discussed about stress in the first half of this program. How much of a role does stress, such as that we encounter in the workplace, is related to asthma?
Well, that's an interesting question. Actually, when I was in medical school, and I'm starting to feel old at this point in my life, we used to talk about kids from broken homes having asthma and anxiety being related to asthma and, you know, certain other sorts of mind-related issues really imposing on people and causing asthma. I think right now, as everyone else has mentioned, we really believe that asthma is an environmentally related disease and a disease that's related to inflammation and genetics. And certainly stress in the workplace and other sorts of factors in a person's life can trigger asthma in those who have it and can cause more problems. These stresses can cause more problems for periods of time for people. But I don't think anyone considers stress per se to be the underlying cause of asthma, but merely one of many factors that can make the asthma worse for an individual.
Dr. Venkat, how does asthma manifest itself?
Asthma actually can manifest itself in various ways. You could have asthma and you could probably not even know that you have it. It could be very mild, presenting itself just as a cough, or maybe you're exerting yourself and you might have a little bit of a cough right after exertion. It can also manifest itself in such a way that you are so short of breath that you would have to go to the emergency room or perhaps, get hospitalized. Now, you could have shortness of breath, you could have chest tightness, you could have a heavy sensation on the chest, like an elephant sitting on the chest. And also, you could be coughing constantly. You could perhaps also, if you see a person who's having an acute asthma attack, the person would be kind of leaning over forwards, and you can look up, there would be an anxiety on the face with a pale looking face. The nasal, there would be a nasal flaring. The person would be breathing very fast, hard. And you could also see accessory muscles of breathing, like the intercostal muscles contracting, and the neck muscles will also be contracting, and the person is almost like in a panic. So there are various presentations of asthma, and perhaps sometimes you could have a cough seems to be one of the major presentations that is missed in a lot of offices. So that's something to think about. If you have chronic cough that is not going away with, within a reasonable period of time, one should pay attention to that.
Okay. Tell us a little bit how you would go about diagnosing asthma.
Well, as we've just heard, asthma really tells its own story to the doctor most of the time. What we see is clinicians, what we hear as clinicians talking to patients often is enough for us to at least have a good idea about whether a person has asthma or not. Certainly we have all sorts of fancy machines like lung function machines that tell us how the lungs work that we can use. But I often find the history is as valuable as anything. And the classic features of asthma, as we heard about, when they're severe and the person's in the emergency room, it actually becomes quite obvious what's going on. But the classic features that we hear in the doctor's office where we see more mild asthma are things like a dry cough that's persistent and seems uncharacteristic given that the individual we're seeing is otherwise well. The cough is generally a lot worse at night than during the day. And often it's a cough that's triggered by exposure to cold weather or exercise. So oftentimes the patients tell us they have asthma just by talking to us.
Dr. Holla just talked about triggers. Have you anything more to tell us about the triggers of asthma?
Of course. There are numerous triggers that will precipitate a bronchial asthmatic attack. One of the most important things in the household is pets, dander from the pets, saliva, feces, urine, as well as the hair of the pets, can precipitate an attack. Cockroaches are well known to be a precipitant of bronchial asthma. Dust mites are there. The other precipitating factors are mold can precipitate, pollens, cold air, as Dr. Horner mentioned, exercise can do that. Some of the food stuff also can precipitate bronchial asthma, like seafood, shrimp and crab, can precipitate. Some of the medications can precipitate. Some of the aspirin can precipitate bronchial asthma in certain people. And one of the things I found very fascinating is recently I've seen several patients with regurgitation, aspiration, like a patient with good symptoms of heartburn. They can have bronchial asthma too.
Can smoking make it worse?
Of course, that's one of the most important precipitant of that.
Okay.
There are something like 4,000 substances are recognized from smoking, and 40 of them are carcinogenic, that is cancer-producing. There are two types of smoking. The mainstream smoking is the smoke which is released by the patient, and the other one is secondhand smoking, not side stream smoking, which is more dangerous, particularly to the kids.
Okay. What about pollutants?
Pollutants, there are a lot of pollutants occur in indoors, particularly emanated from appliances. For example, furnaces, wood fireplace, gas heaters, variety of different things, what we have at home. And they release some of the fumes like carbon monoxide, sulfur dioxide, and nitrogen dioxide. All these things are injurious to direct irritant to the bronchial asthma, and they go into spasm and bronchial asthma attacks.
Amongst one of the trigger factors that Dr. Prabaker mentioned, I think
Yes.
viral infections are important causes of as a trigger of asthma. And it's important, if you have, besides cold air, aspirin, it's the most common cause, I think, of a trigger factor is a viral infection, particularly RSV infections in kids.
I think it's very important to make that statement, that the two most important triggers of both the inflammation and asthma attacks are viral infections and allergens. Foods are not one of the more common aspects. They're important to note, but for the most part, foods aren't the issue. And I think that it's very important that people recognize that the indoor environment is probably the most important environment, because the average American spends maybe 15 minutes to 30 minutes truly outdoors these days. And most of the rest of the time we are in our office, our workplace, our car, or our home. And it's those environments that are much more important to us than what's outdoors.
Okay. You just talked about office and home. How can we prevent asthma attacks?
Well, one of the most important ways of preventing asthma attacks is first to recognize the triggers. And each individual has their own trigger, plus there are some general triggers. It was mentioned earlier that cold, dry air and exercise in cold air can certainly trigger many people. Almost everybody with asthma will have exercise exacerbations of their asthma. But for those individuals for whom it's an allergen, knowing that allergen by visiting an allergist and being tested to know what that allergen is can give you advice and counsel about how to avoid that allergen if at all possible. That's one. The other is many irritants abound in our environment. Most of us have had the irritant of someone in an elevator with too much perfume or too much aftershave that can be irritating. The same thing can happen when you walk down the detergent aisle in the supermarket and you smell the strong smells from that, or bus exhaust or fumes. Those people who work in industrial settings, some of those industrial settings are absolutely pristine. People sit in front of a computer screen all day long and are not exposed to much of anything. But there are others who work in auto body repair shops and who spray paint or who solder, so that it's very important for the physician, the general internist, the asthma specialist, to take a good history not only of what the symptoms are, but the history of what the patient exposes themselves to in their home, in their workplace, and their hobbies. It's very important to know about the hobbies of people too, because many people have a very pristine work environment, their home is fine, and then you find out that they like to paint or they garden or they do things that might expose them to additional
Dr. Wasserman, could you tell us a little bit about the modalities of treatment of asthma?
Certainly. One of the prime modalities of treatment of asthma, first of all, is to recognize the triggers and try to avoid them when at all possible. But the goals of asthma therapy are not to hide. They're to have a normal life, to be able to be active and in the world. So kids shouldn't have to miss school. They shouldn't have to hide from their physical education classes, and adults should be able to do what they wish. So how do we treat asthma? The foremost treatments have to do with controlling the inflammation and controlling the bronchial constriction. For all but the mildest patients, for anybody who has symptoms more than 2 times a week, they should be on what's called a controller medication. And a controller medication is usually an anti-inflammatory medication such as inhaled steroids, inhaled glucocorticoids, or inhaled cromolyn or nidocromil. And those medications are the cornerstone of therapy for all but the mildest patients. Then patients need to have what's called a rescue inhaler. A rescue inhaler is a beta-adrenergic agonist. This is a puffer that many people see that causes the smooth muscles in the airways to relax. It's called a bronchodilator because it dilates the bronchial tree, opens it up, and lets the air move more easily. And that's a kind of medication that should be used as needed as a rescue medication, not on a scheduled basis. The inhaled controlling medication, the steroid or cromolyn medication, should be used on a scheduled basis. For patients whose asthma is more severe, there are long-acting bronchodilators that can be used twice daily to keep the airways open all day long. Those patients still need a rescue inhaler if they get an episode. And then there are other medications that one may have heard about. One are the leukotriene receptor antagonist medications, which block a particular chemical which is important in asthma, called leukotrienes, and that medication has been very popular. In addition, most patients with asthma have associated nasal disease. The patients with associated nasal disease have exacerbations of their asthma based on what's going on in their upper airway. So treatment of the upper airway is also important. One is to recognize that the upper airway is involved, and then to use appropriate treatments. They may be antihistamine treatments to prevent the dripping, sneezing kind of symptoms, or they may be, again, additional inhaled steroids in the nose to decrease the inflammation and to decrease the congestion in the nose. So I think those are the cornerstones. Now, there are other medications that may become popular. One can read as well in the lay literature and sometimes in the medical literature about additional so-called alternative or complementary therapies. And these may go as far afield as vitamins, acupuncture, and herbs. And I think it's important to recognize that asthma should be treated with a controller medication and a bronchodilator. If one wishes to add these additional therapies, one should do so with the understanding of one's physician, because some of the herbal medications and others, particularly in allergic patients, can trigger allergic reactions. So it's important for the physician to know what the patient is taking. I'm not against using those modalities, but they should not be the central or cornerstone therapy of the treatment.